Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Perfect.
No, we talk a little bit.
Okay, med spa. We're talking about the med spa, Dr. Mencia. You seem to be so excited about this. And here you've been practicing medicine for so long. You've been going to spas yourself, but now you're doing this. But maybe I did say that I'm going to go now and try everything. The salt bed. I'm going to try the ionic. What do you call it? Ionic
The foot
bath?
detox.
The what?
The foot detox.
Food
The
detox.
foot detox that's going to tell me different things. And I'm going to go and have the Vichy shower. Okay. Now, do I go in a bathing suit for all this? What do I do? How do I?
No.
You can go naked.
No. What you
Bring
are
a robe.
you are completely naked in the Vichy shower.
Yeah.
What they do, they cover your breast and
Your
the
private.
bottom with the towels,
With certain towels, yeah.
and they cover you up. But during the session, the therapist can ask you. Some people comfortable of being naked in front of the therapist. Some they don't want anybody to look at them. So therapist will ask you, "Is that okay if I lift the towel and I clean you
Yes.
there?
Right.
I exfoliate your skin.
Yes.
I'm not gonna take it off, but just lift it.
Yes.
Go there, do it, and cover your back." Some people say yes. Some people say no.
And how long was a
But you-
treatment like that take?
The whole treatment is hour and a half.
The Vichy is a half.
Yes.
Oh, because they're gonna.
Because
it's
You're
what
gonna be-
happens-
you're gonna be a
no,
new
because
person.
what happens
I
is
need to have that.
after exfoliation, she does the body treatment with mask with seaweed or
Oh my
black
goodness, I
mud,
love this.
and then they wrap you to make you like
Like a
Little
candy.
cocoon.
yes, and you stay warm and nice. And for 30 minutes, you're laying down there. They dim the lights, and you're laying down on that
You go to
bed.
sleep.
And it just, yes. And
Yeah, this is
there is a
amazing.
feeling that you're on a boat because everything is like it's dark, the water is running. And I had the feeling, I started falling asleep. I had the feeling that I'm on a ship or on a boat. It was amazing.
Right, like you're on a float on the water. 'cause
Yeah.
It does feel like you're floating
You
on water.
just made, okay, everybody, listen. Treat yourself. You don't have to go to Germany or to one of these
Exotic
famous
places and
spas,
spend all the
exotic-
money.
That's right, Hawaii. Of course, it's nice to go there anyway. But first, let's go to the Stonewater Med Spa. Phone number is 954-561-8799. And please go and welcome Olga Pardo. We like to welcome all of Dr. Mencia's, new physicians and associates. And you're it. You're very lucky,
Thank you.
It sounds like he's very lucky, but you're very lucky.
We're
And he-
both very lucky. We got each other.
Oh,
Yes.
yeah.
We got each other. I
That's
have Olga.
right.
Olga
and
has
of
me.
course, if you have to be really nice to Ina, because Ina's really the heart and soul of this whole environment, and you don't want to.
That's easy.
No,
She's
we are
nice.
the best
Don't be
friends,
mean to
yes.
her, please.
Oh, you can't look at her. She looks
She'll
so
say
dull. You
some
can't.
bad things
Yeah.
to you in Russian.
Look at that baby
We
doll
don't want to
face.
see
How could
those
you
eyes
possibly
crying.
Oh,
We don't want to see tears on those eyes. No, we can never be into
We're
it.
not going to do that. So, Dr. Mencia, so now that you have the Stonewater Med Spa, and tell us just for really fast, do you have anything new going on at your AGI Medical Center? We don't talk about the dental very much, and I was
The
wondering
dental,
about that.
well, no, the dental we are doing extremely well. We are doing a lot of implants. We are doing everything. We're covering dental from A to Z. And I'm very happy with that because at the beginning it was all medical. And we used to have all the consultants in the medical side. For example, today, long weekend, most doctor's offices are closed.
Not yours.
No, we are open, and not only that, the dental department is working. We have the neurologist today seeing patient. Try to get a neurologist on
Saturday.
July the 1st, which
you
is
can't
a
even get
Saturday.
neurologists, no matter
It's
what.
hard to get a neurologist on a weekdays.
Yes.
You can see a neurologist if you have a migraine today at the office.
Okay, I got to
So
give that phone
this
number.
is very hard to get specialists to come in. Dr. Raskin come and do health gynecological exam on a Saturday. Dr. Labobian, the
We
dermatologist,
have
come and see patients.
dietitians.
The dietitian come in on Saturday. So it's so wonderful for people like us that work, throughout the week to be able to take a Saturday and go and have our health taken care of. So the fact that you are working and you don't have time off is not an excuse anymore at AGI because you
No.
can come on a Saturday and,
It's
and
just
get yourself
fabulous.
taken care of.
Let me give you a phone number.
And
for that. Yes,
it's
yes.
the
Speak, Dr.
4th of
Mencia.
July weekend, right? So a lot of people gonna have guests over, and you don't know what to do with them. So you call Olga, ting, 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 at 954-561-8799. Olga, Herb, I need to send you all these people so you entertain them for a day, and we'll give you a break.
Okay, wait.
What a great idea.
But wait, that's a good point. So tell us your days and hours now this weekend.
We are actually open 7 days a week, and now we have extended
Excuse
hours.
me, wait. 7 days.
That's what
The
we
show
get.
You
must
are
go
a
on.
slave driver. You
We
know
are.
that.
No. We distribute among
Yes.
each other.
Wait. I am so excited. You're open 7 days a week there at the Med Spa?
Yes.
Okay. So you're not only open today, you're going to be open tomorrow
And Monday.
and
And
Monday.
Monday.
Now, Tuesday, please, let's have a little break, okay? It's a holiday.
No, Tuesday we are closed.
Yes.
Yeah, at least
Yeah.
Tuesday, this Tuesday.
Yes.
Yeah,
But
for
normally,
for
it's
major
7
holiday we do
days a
close.
week.
Yes.
Yes.
Yeah.
And what time do you start in the morning?
We open at 10 and we close at 8.
So you actually have evening hours. 8
Absolutely.
Yes.
People work.
for
They need
people
that.
to come
Yes.
afterwards,
Absolutely.
10
Yes.
to 8. Oh, my goodness. This
So
is a great show.
when you have your guests over the weekend, your
What a
family
lovely
member,
thing to do.
you don't know what to do with them, where to send them, Stonewater.
That's right.
And you said something about your kids going there when they were very little. That's really happening now. A lot of children, 10-year-old children, want to go and get their
Their
nails
nails
done
done.
Yeah.
and their little feet done. It is so cute.
And Olga can tell you much better than I can, but because being a doctor, I have to make sure that we don't transmit any disease. She can tell you when you get your feet done, the utensils that are used where they bathe your feet that get thrown out after you are done, and a new one get put in there, so there's no fungal infection. So, and I tell you, I used to bring my kids over there, and I would rather go there than go to a nail salon because of the level of hygiene the spa will bring.
I was just going to say that to you, that a lot of these places that open up and you see them and they're,
I see the patient
Oriental,
coming at me all the time, say, Doctor, I have this on my nail. What
Infection
happened?
or something.
And we go, it's a fungal
yes.
infection. You caught a fungal infection. And then we have to treat it. Sometimes you have to remove the nail when it's really bad. So there's
you're
a
very
lot of things
careful
that can
about
be.
this.
Well, when you go to any spa, you're supposed to be getting a level of treatment much higher than you would get in a regular nail place.
Oh, boy. So,
Yes,
so that's a
very
very,
important.
very, very good point,
Very,
too.
very important.
But so the children now can go, they love that. So you
They
said,
do.
talk about taking them somewhere. They feel so cute. You see the little nails
Yes,
done.
and the mommy and daughter day where they can get the manicures and pedicures together.
They get a little lemonade.
Yes, they get a little lemonade while mom has a mimosa.
I love the mimosa.
Mommy mimosa, little girl.
And Dr. Mencia, you have developed products too. We don't talk much about that. I know you have them at your main office at the AGI, but what do you have now at the spa?
Well, at
Same
this
kind
part,
of thing?
I'm waiting for Olga to establish that. We have to have a good manager to get to that point of putting products. There's one of the product, a line of product that we can have there because now you have a medical director. Is the Obagi products. Now, when you go into the treatment room, they don't use the Obagi product because it's a medical line. They use what Olga bring into the place. But sometimes you go to a spa, and if when you don't have the right management, and I want Olga to tell you a little bit of her past. How she got to where she is today. When you go to a spa, you can get product that they buy at CVS or Walgreens, and that's not what you're going there for. You go to get products that are top of the line. that you know is going to be beneficial to your body and won't produce bad reactions. So tell us, Olga, a little bit about.
Yeah, that's a good thing,
Yeah,
Olga,
because I
or
want
Dr.
them to
Mencia.
know
I
her.
understand that, but so is there really something to the different products that you buy on the shelves?
There absolutely is.
And ones that are created by famous people and all that. Is that really true?
There absolutely is. A lot of the brands that are used in salons and spas, they try to maintain the integrity of the name of the product. So it's a salon. It's almost like, I will compare it to medicine. What a doctor can prescribe you and what you can get over the counter at a pharmacy are two completely different things.
Exactly.
And a doctor is going to know what to prescribe for you because he's treated your ailments. You're just going to take a guess when you go to a pharmacy. Same thing when you go to a professional. They assess your skin. They assess your lifestyle. They assess how much time you have as far as upkeeping whatever it is, your hair, your skin, your hands. So they will recommend what is best specifically for you. And it's made differently. It's a little pricier, but I have found that the difference is a lot of the products that are sold over the counter in pharmacies are more diluted with water and alcohols, which eventually, you wind up spending more money. The products that are usually made in salons and spas are much more concentrated, so a little bit goes a long way. So once a person makes that transition, they'll know that economically it even makes more sense. And they get the results that initially their esthetician or their hairstylist created for them to begin with. And the whole idea is whatever you do for your patient, for your client, you want them to upkeep it once they're away from you. And that's part of the process. And in educating your clients in what it is that they can do to maintain their look. Because a lot of times, they invest in facials and treatments, but then they go and use, something from over the counter and probably undo the investment that they just made. So we just are kind of protecting their investment.
Okay.
And when you see an esthetician, it's a licensed person.
Yes.
It's like I am a licensed physician. Now there are doctors out there that they are not licensed.
Unfortunately.
So when you see an esthetician, you see a licensed person. And what that means, they had been trained, they had been licensed by the state. And they understand, for example, when it comes to skin typing, there are 6 types of skin typing that we go. And there are certain products, like let's say an acid to be put on the skin. The Ina that will be skin type A1, because she's very light skin with her eyes and all of that. She will fall into skin type 1. And a black person will be skin type 6, and then you have everything in between. So when you use products, sometimes people say, I don't have the time, I'm not going to go to the spa, I'm not going to spend the money. And they go and say, let me go on the internet, Dr. Google. Look at this product, let me buy. And I have a pharmaceutical rep that she comes to me every week. Oh, Dr. Mencia, make sure you prescribe my product. It's good for this, and this one is good for that, and what have you. And pharmaceutical reps, both men and women, they have to dress properly. They have to keep their skin intact and beautiful and what have you. And we see pharmaceutical rep every day. She goes 2 weeks not coming to the office. And I say either she got fired or maybe they relocate her. So I asked my secretary, will you please pull out her name? I want to get her number. Let me call her. So I call her up. I say, are you okay? You are not coming to my office. So she goes, oh my God, Dr. Mencia, you miss me? I say, yeah, you are here every week. And I sort of like, it's not you unless you went on vacation. Are you okay? She goes, no, Dr. Mencia, I bought some product. And what a great person to talk to, because I know you do aesthetics at your office. So I bought this product, put it on my face, and my face is like a burn, like if I have a 3rd-degree burn on my face.
Gosh.
And, she has an olive skin. And with the product that she used that would be great for inner skin, now she has black spot all over her skin. Now, when you do things like that, you are playing Russian roulette. Russian roulette. You know, say, yeah, we're still here in the
In
roulette.
business.
So, you know, you buy this product and you don't know what you're putting on your body. And my recommendation, if you want to still do that, don't put it on your face, for God's sake. Put it on your chest, put it on your back, and see what kind of reaction you get if you want to, you know, play with product. And then put it on your face. But you get people, they put product on their hand, and they damage the skin on their hands. So, you know, when you come in, Olga and her staff, they will analyze your skin. And then we determine what is the best product for that type of skin to keep it beautiful. Because you can have beautiful olive skin without any burning or anything like that when we use the right product. So,
Well, so as you're saying that, I'm thinking, do you do makeup there? So if someone wants to go somewhere, can they come and have someone make up their face?
I'm actually doing a lot of recruiting, and I'm making sure that we're having people on staff that provide multiple services, and part of it would be makeup. A lot of people, when they do have, especially when it's a couples thing, if they have a couples package and they just spent the whole day at the spa, having lunch, relaxing, we actually have a room, a little boudoir where they can just change, do their makeup, freshen up so they can go out straight from there. So I'm definitely looking into, I've interviewed quite a few of
Makeup
cosmetologists
artists.
that actually do makeup as well.
I'm looking at, actually at Ina, which is for TV. Your makeup's gorgeous today. Did you do that or you had it done?
No, I do it myself. My
See,
hair,
but no, you
my
do
makeup.
not ask her. She has too much to do now. I'm telling you, she is such a talented person.
Yes.
Because she said, I'll come and do it. No, but you do that yourself. Now, where did you learn that?
I just did it one day. I liked
Gorgeous.
it. And,
Wow,
and
you're-
everybody loved
She
it.
used to go
Everybody
to the
was
mall.
You look fabulous.
she
Nobody,
used to go to the mall and say, okay, let me try.
The palette that you're working with. She's got
Right.
a beautiful, beautiful
but
face.
but she
Thank
really
you.
has a lot of things that's just gorgeous, right? So maybe we get you.
No,
to-
this is something I like to do. I like everything. That's why when Dr. Mencia bought this spa and I got thrown into this, I really enjoyed it because I love
She was
it.
happy.
Yes, I love all about beauty. I love all
Yes.
about clothing and hair and every. It's something I
this
like
is
to do.
perfect.
So,
So someone will be able to eventually then come and they'll have themselves made up and everything.
everything.
Well, I can see people getting married or doing things coming for a whole day. And you take
Absolutely.
all the bridesmaids and you do a whole thing for it, right?
Absolutely. They
Yeah.
can even have a little bridal shower
Yeah.
for the immediate party of the bridal party.
Yeah, that would be
Yeah,
wonderful.
Little spa party.
There's so much to do here, and you.
And the nails, the nails.
yes, we, as a matter of fact, we're gonna have a full-time employee soon coming in the middle of July, and she's a full specialist. She does hair, she does nails, facials, and the nails, something which is very popular nowadays.
now.
It's a dipping powder,
a
which
dipping powder.
yes.
And what happens?
You dip yourself into the powder.
It's a lot safer than acrylic, I would say, and it stays longer. Your nail just grow, but it doesn't chip or anything. It just stays there forever.
Interesting. So what you're going to do is try to have like you do with medicine, Dr. Mencia, you're going to
Cutting
have
edge.
the
The
cutting,
cutting
edge
edge
things that
things.
they're going to
Right.
be very, very important. Well, it's a wonderful thing that when Dr. Mencia first invited me to come see the med spa, I went crazy. But you're right. It had been closed. And then then he did the fountain. He brought that back, which is gorgeous and beautiful. But the nice thing is there's plenty of parking. We have
Yes.
to talk about that because parking's always a problem.
Right.
But they can just go and they park on the street or right in the next little
Right in front of
area,
right in front of
right
the
in front of it.
the spa.
And then there's that restaurant. Did it
Yes.
finally open? Ina?
It's coming soon.
Yeah, I believe
Pretty soon.
today was I went to the soft
Oh,
opening.
really?
Yes, we're very excited.
Yes.
Yeah,
Food was
it's
very
Oh,
good.
Italian,
beautiful.
isn't it?
Italian,
It's an Italian
yes.
restaurant too.
Yeah, it's
Yeah.
called Sicilian Oven.
What is it called?
Sicilian oven.
Sicilian oven.
Sicilian oven. Okay, we had to make sure it has good food besides
No,
just
they
Oh,
do.
it's
pasta.
excellent.
Oh, pasta.
Sicilian.
Just one-
They
Oh,
have
yeah.
amazing salads and everything,
Perfect.
so
They
that's
have cocktail,
beautiful.
a full cocktail
Yeah.
bar. Beautiful.
Okay, well, we're doing some
Is it
commercial
a
for them.
wooden?
You can
Is
tell
a
them.
wooden oven or what is
Yes.
it?
Yeah,
It's
yeah.
a,
That's
so,
the
yeah,
best.
it's very
Yeah.
The
Gonna have
pizza
that.
come out
And
like
we probably want to mention the open house that we are planning to do.
Oh, yes.
Yeah, I
Yes.
asked about the
Yes.
open house. She
Yes.
didn't have a date yet. She
Yeah,
said.
no, we do for the open house. It's for the grand opening. That I'm not sure what the exact
Okay,
date is.
so
Yes.
let's talk about the open house. I hope it's not in July because we've already finished our magazine.
It is July.
It's
Too
July.
bad, you don't keep in touch with me. Okay.
Yeah, I will.
No, okay. So when is it in July? Because we'll have
Hold
to talk
the
about this all the
printing. Hold
time.
the printing.
It's July 17th.
What?
July 17th, Monday
Okay, July 17th on a Monday. What's the time?
at 6 o'clock.
6 o'clock. So we'll talk about it all the time. July the 17th. That's a Monday.
Yes.
And it's at 6 p.m. And what's going to happen? People can go through it.
Olga.
Absolutely.
Just go through
Yeah,
and see everything.
there's a lot of people that are interested that we've been interviewing as far as possibly coming on as part of the staff. There's a lot of people with local businesses, new contacts that I've made
Okay,
already and previous
right.
contacts. So it's sort of like a meet and greet, networking, and having the possible candidates that I have on reserve for Ina and Dr. Mencia to meet as well. So it's basically to let
And
people-
Olga.
Yeah, well,
wait. But is this for now? Wait, is this an open house for people like that, or is it for the general public?
It's mostly for the people like that.
Right.
For the
So, for
general
example,
public,
if you are
Yeah, so
into
that's-
real estate and you sell a property, and then usually when you sell a property, you're gonna get a commission, and you want to give something back to the buyer. So you might want to have a package. Say, let me give you a day at Stonewater.
Yeah,
and
it's a
then
great
we'll have-
idea.
Right. Hotels, there are many hotels that they don't have hair and nails, but they have massage and facial. So whatever the hotel in the area they don't have, they can complement with us.
Very much so. That's a very
so
good
it's more
idea.
of a networking event just to let people know.
Oh,
reintroduce
okay. So it's a
ourselves.
networking.
Yeah.
So it's not really what would have been appropriate for the magazine anyway. So
yeah,
it's fine.
that will be in
that's
October,
when
November.
you do your big thing.
Yeah.
So right now, okay. Well, I will certainly. Then I should invite kind of business people and whatever everybody
Absolutely.
I can invite
Right.
to come to that. Now let me tell you about the address again. The best way to get there, I think, is take I-95, get off at Oakland Park Boulevard, and go east. And it's probably about 3-4 miles from I-95,
Right.
something
It's
like that.
just before going over the bridge. When
Yeah,
you're going to
good,
the
good.
intercoastal.
Just before, if you
Just
go over
because
the
the
bridge, you've gone too far.
Right. The light,
Right
the
before
light
Bayview.
before the bridge, that's Bayview.
Okay.
That's Bayview Avenue.
So then you take a
So,
left. It's right
so
there
you
on the
will
left.
make a left, and
Yeah.
you will be right
Yeah.
there on the left.
Yeah, it's very, very nice, and it's very safe, and I think you
It
really
had been
should go.
it had been in that location for 27 years.
Wow.
So
Okay, well,
it's very
it's-
well known by people that have lived in the area for for many years.
Right,
I
but
mean,
now it's special because now we have Olga, and we have Ina, and we have Dr. Mencia running it.
We have a
And-
team.
That's
A
right.
team, a
and
team,
we have
954.
Anita.
And they're open 7 days a week, which is phenomenal. It's 954-561-8799. But let me also give the AGI number because they are open today. Remember, get a long weekend. If you're not feeling exactly right, go today. Get yourself taken care of. They have a neurologist today, which is also amazing. It's number there is 954-489-1345. That's 954-489-1345. And we're all going over to Dr. Mencia's today. I shouldn't say that because, no, I know that. But we won't tell you where he lives. He lives in Alaska. He goes from Alaska to Hawaii.
We're going
Kidding.
to the office. We're going to the spa. We're all going to the spa.
The spa.
It's all about the
After work.
It's all
Right?
about the spot. About the spot. Oh,
But
baby.
you have to go to work first, and then you can party later.
But we have time, right? We have time, Richard?
No,
One
it's
minute?
Work. Yeah.
It's over.
Oh.
Back to work.
Yeah, we
But
have wonderful.
dental is
Yeah,
fully open.
dental is wonderful.
The spa is
Neurologist.
open. Neurologist is there
Spa's
seeing
there.
patient. I'll be there seeing patient.
Oh, I'm telling you, this is one wonderful day. And we had a great sunrise, and we're going to have a great
Weekend. It's going to be a great weekend.
great weekend.
Yeah.
And you'll be open. Oh, wait, you'll be open on Monday, though,
We
right?
are open on Monday. We
Right.
work.
No, that's right. A lot of places aren't. You know,
Yeah.
they're taking
Yes.
this whole, which is not
No,
right.
no, I'm giving my staff Sunday and Tuesday off. So,
So
they're
you
very
are
lucky. Sunday and
Sunday,
Tuesday.
Tuesday.
Yeah,
Okay.
they won't see patient on
Oh,
Sunday
you're
or
bad.
Tuesday this week. They're
Thank
lucky.
you,
They are so
everybody.
lucky.
Okay, everybody, don't forget, we have our big expo coming up on July the 25th. But we'll be back with Dr. Mencia next week. Thank you. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.